I've always said that children can get COVID, can get the coronavirus. Initially, they may show very mild symptoms, runny nose, cough. Initially, children were not being hospitalized. But then as the weeks started to move forward, we noticed that a lot of young people, a great number, like 29% of young people between the ages of like 20 to like 40, it's like young adult to like middle age, were being hospitalized. And what has developed since March, we've seen it usually like by May, we started seeing something called the multi-system inflammatory syndrome - children. And this is a complication that it's very similar to what we call, it's very similar to a disease called Kawasaki's disease, which is vasculitis, which is an inflammation of blood vessels, very similar to this disease that, I've seen a couple of times. I wouldn't say that it's super, super rare, but I've seen it as a resident. I've seen it as an attending. But this disease, this MIS-C, is a much more severe presentation. It's not, they don't call it Kawasaki's in this population. They call it this MIS-C, and it is much more severe. I mean, we have children in New York State. Up to 2 or 3 weeks ago, we had 147 kids with this, with a number of deaths. I think about 3 or 4 deaths. And the children they get really sick. Really, it's much more severe. They initially start off with like GI symptoms, diarrhea, vomiting, but then they can start showing signs of cardiac complications or cardiac injury. One of the complications of Kawasaki's is coronary aneurysm, and they're seeing the same thing, but this is a much sicker presentation than Kawasaki's. So that's what we've seen in the past couple of weeks, which is, really frightening. I know my parents, when I, do my telemedicine and when I do my calls, like if their child has a fever, that's the first thing that pops up. And, and even as a physician, I tell them, I'm like, look, we have to be very careful with this because it can progress pretty quickly. And, the minute you see, certain signs and symptoms, you have to present to the hospital. You have to take them in. So, yeah.